Welcome to SSR Pharma Media. Today's series Inventory Crackers, Crack the Exam, Drugstore Management, Inventory Control. Today we are going to discuss about review of slow and non-moving items. Prepare, practice, succeed. So inventory control techniques. So already I told this topic is present under diploma syllabus and B.Pharm syllabus in many competitive exams. So recently called RRB exam. So in that RRB, this topic is present under the pharmaceutical marketing and management. So inventory control techniques are, there are 9 types are there. First one is ABC analysis. Second one is economic order quantity. Third one is VED analysis. Fourth one is perpetual inventory system. Fifth one is review of slow and non-moving items. Sixth one is input-output ratio analysis. Seventh one is setting of various levels. Eighth one, use of material budgeting. Ninth one, establishing on effective purchase procedure. So among this 4 we have already discussed. So today we are going to focus on review of slow and non-moving items. So we see the question. First question, what is the main purpose of reviewing slow and non-moving items in inventory control? Option A, to increase production cost. Option B, to detect counterfeit material. Option C, to reduce inventory cost by identifying unprotective stock. Option D, to increase the number of dormant items. So the answer option C, to reduce inventory cost by identifying unprotective stock. So this review helps in identifying slow moving, dormant, obsolete items that added to the total cost without contributing to productivity, thus helping reduce overall inventory cost. So you must know about slow and non-moving item, means you must know about 3 words: slow moving, dormant, obsolete item. So slow moving you will understand. Dormant means stocking for long period. Of course for obsolete also the meaning is stocking the drug for long period, without moving. That means without selling, the drug will present for long period. So it is called obsolete items. Sometimes it become expired also. That's called expiry drugs. So review of slow and non-moving items. The purpose of view, reduced cost by identifying unprotective stock. Periodic report, track purchase, usage and stock of non-moving items. Monthly or reports quarterly. Dormant item means temporarily unused. Obsolete item, permanently unusable due to changes in design, product, process. So without selling, the drug must be stay in the long period. So it is called obsolete item. So obsolete item means, so it is changes in the design, product and process. So very important. There are many questions they are asking from this word, by using this word. So the permanently unusable due to change in design, product, process, useless with passage of time. Identification of obsolete item for disposal or alternate use. Expired drug classified as obsolete. Moving ratio, measure the turnover rate of slow / dormant stock. Ideal inventory, between excessive and inadequate. So inventory ideal means should not go excess or should not go inadequate. So, between these two is called ideal inventory. Next question. Which of the following is an example of dormant item? Option A. An item changed permanently, phased out due to design change. Option B. An item that is damaged during shipping. Option C. An item purchased in excess by mistake. Option D. An item not moving temporarily due to seasonal demand. So, answer is option D. So, dormant, an item not moving temporarily due to seasonal damage. So, dormant items are temporarily unused due to seasonal or cyclical production pattern. So, unlike obsolete items which are permanently unusable. So, you should know the difference between dormant and obsolete. So, both are in a meaning, we used to say in the meaning means staying for long period. But there is a difference. Temporarily unused means dormant. So, after sometimes, according to the season, it will move. But absolute item means permanently unusable, like expired drug. Next question. How are slow moving items to be valued according to the review system? So, option A at original purchase price, option B at cost replacement price, or net realizable value, whichever is less. Option C at highest market rate. Option D at discounted price fixed by supplier. So, the answer is B. So, this conservative valuation method ensures that slow moving inventory does not inflate the asset value and reflects its actual worth in financial items. Next question. Which of the following steps helps in identifying slow and non-moving items? Option A. Absolute item identification and moving ratio. Option B. Price comparison. Option C. Employee feedback. Option D. Quality assurance testing. So, the answer is option A. Absolute item identification and moving ratio. The text mention periodic reports, absolute items and moving ratio as tools to detect and analyze non-performing inventory. So, next question. Absolute items are best described. Option A. Items that are returned by customer. Option B. Items used only during festival. Option D. The item that have become unusable due to changes in design, product, process. Option D. Items temporarily not in use. So, you will know the answer is option C. So, obsolete items are those that can no longer be used or sold, often due to technological or process changes. Next question. What is the purpose of periodic report in inventory control? Option A, to determine the expiry dates of product. Option B, to monitor purchase, consumption and stock of non-moving items. Option C, to calculate profit and loss. Option D, classify items into ABC category. So, the answer is option B, to monitor purchase, consumption and stock of non-moving items. So, a periodic report, monthly or quarterly, tracks the purchase, usage and balance of non-moving stock, helping management identify excess or absolute inventory. Next question. What is important to identify obsolete items in inventory management? Option A, to increase the reorder quantity. Option B, to utilize or dispose of them and avoid further purchase. Option D, to include them in profit calculation. Option D, to replace them with low cost alternatives. So the answer option B, to utilize or dispose of them and avoid further purchase. So obsolete items are unusable due to design process changes. Identifying them helps in preventing further wasteful procurement and planning proper disposal or usage. Next question. What does the term moving ratio indicate in inventory control? Option A, the price change of raw materials. Option B, the suppliers to buyer ratio. Option C, the turnover rate of slow, dormant or dead stock. Option D, the shelf life of moving items. The answer is C, the turnover rate of slow, dormant and dead stock. The moving ratio measures how frequently items are used or moved from inventory, helping identify low turnover items for management review. Next question. How frequently should moving ratio be calculated to manage inventory effectively? Option A, once a year. Option B, only when losses occur. Option C, every time a product is delivered. Option D, periodically, monthly or quarterly. So the answer is option D. So periodically, monthly or quarterly. Periodic calculation of moving ratio helps continuously monitor inventory turnover and avoid stop filling non-protective items. Next question. In drugstore, the expiry dated drug formulations are known as option A, absolute, option B, scrap, option C, surplus, option D, dormant. So the answer is absolute. So expired dated drug means it's called absolute items. So already we have discussed this in previous video. ABC in inventory control techniques, 9 techniques. Among these 6 are very important. ABC means always better control. So ways of classification, annual consumption, value and key focus, financial impact. So VED analysis, vital, essential, desirable. For base of classification, criticality of patient care. So important, focus of key focus, medical importance. And EOQ, economic order quantity, cost optimization. So key focus, ordering versus holding cost or inventory carrying cost. SFSN, fast, slow, non-moving. Today we have discussed this. So base of classification, usage rate and key focus, movement in inventory. HML, high, medium, low. So unit cost, key focus, cost per item. SDE, scarce, difficulty, easy. So procurement, difficulty. Supply chain management. So this also we have seen in previous video. ABC is annual consumption, financial control. VED is a clinical importance, availability. EOQ is a cost optimization, ordering rise. And FSN is a movement speed, stock turnover. HML, unit cost, pricing strategy. SDE, availability, supply chain. So these techniques are very important. Always better control, vital, essential, desirable, economic order quantity, fast moving, slow moving, non-moving, high, medium, low cost, scarce, difficult, easy to procure. Next question. An ideal drugstore if its inventory is option A inadequate, option B in excess, option C at levels between excessive and inadequate, option D meager. So tell your answer in the comment box. So join our WhatsApp community group. You will get two benefits: hands out and online test practice. Check your knowledge by joining in our community group. Thank you. Like, subscribe and share.